Okay, let's dive into this. We're going to talk about a condition with a name that sounds pretty intense, hydrocephalus. Maybe you've heard it called water on the brain, which, let's be honest, sounds like something from a horror movie. But what's actually going on?
So, what's the deal with that phrase? Is there really water sloshing around inside the skull? And how on earth would it even get there? Well, that's the exact medical mystery we are about to solve together. All right, so first things first, it's not actually water. It's a really important fluid called cerebrospinal fluid, or CSF. And in hydrocephalus, you get a serious traffic jam, a big backup of this fluid inside the brain. But the real enemy here isn't the fluid itself, it's the crushing pressure that buildup puts on the brain.
I think the absolute best way to wrap your head around this is to think of your brain as having its own super complex plumbing system. It's designed to manage this CSF perfectly. Hydrocephalus is basically what happens when that plumbing system has a major breakdown.
Now, this is where it gets kind of wild. Your brain is a little CSF factory. It churns out about 500 milliliters of this stuff every single day. That's more than a can of soda. But at any one time, there's only about 150 milliliters in the system. So what does that tell you? It's constantly being made, circulated, and then reabsorbed. It's a beautiful, dynamic system that cushions your brain, feeds it, and takes out the trash.
So what happens when that perfect balance gets thrown off? Well, you get this really dangerous domino effect. It starts when the flow gets blocked or it just isn't getting absorbed like it should. Then the fluid starts to pool, and these spaces in the brain called ventricles begin to swell up like overfilled water balloons. This causes the pressure inside the skull to skyrocket, and that pressure literally squishes the delicate brain tissue, causing serious damage.
In that plumbing analogy we talked about, it perfectly illustrates the two main ways this system can fail. First, you have non-communicating hydrocephalus. Just think of a clogged pipe. There's a physical blockage, like a tumor, stopping the fluid from getting where it needs to go. Then you have communicating hydrocephalus. In this case, the pipes are wide open, but the drain is busted. The fluid can circulate just fine, but it can't get reabsorbed back into the bloodstream.
Okay, let's switch gears and talk about symptoms, because this is where it gets really fascinating. The warning signs for hydrocephalus are completely different depending on how old the patient is. So, why? Why would a baby and a full-grown adult with the exact same problem look so incredibly different on the outside?
You know, in medicine, there are these little rules of thumb that get passed down. And for infants, this is a big one. Big head baby equals think hydrocephalus. A head that's getting bigger, faster than it should, is a massive red flag.
And here's the aha moment that explains why. An infant's skull isn't one solid piece of bone yet. It's made of soft, flexible plates. So as that pressure builds up inside, the skull can literally expand to make room. That's why you see those very visible signs: the large head, a bulging soft spot, even a strange downward look in their eyes called the sunset eye sign. But in an adult, the skull is a hard, rigid, bony box. That pressure has nowhere to go but inward, pushing on the brain and causing those awful neurological symptoms like blinding headaches, vomiting, and vision problems.
Okay, so we know what it is and we know the signs to look for. How do doctors confirm a diagnosis? And more importantly, how do they fix this critical plumbing problem? Well, diagnosing this is all about getting a look inside the head. Things like CT scans and MRIs are the heavy hitters. They can show those swollen ventricles and even find the source of a blockage. For little babies, a simple ultrasound right through their soft spot is a fantastic, safe way to see what's going on. And of course for them, just measuring their head circumference every day is absolutely crucial.
Now you might be thinking, can't you just take a pill for this? Well, there are some drugs that can lower the pressure for a bit, but they're really just a Band-Aid. At the end of the day, this is a mechanical problem, a plumbing issue, and a mechanical problem needs a mechanical solution, and that means surgery.
So the most common fix is something called a ventriculoperitoneal shunt, or VP shunt. And when you break it down, it's an incredibly clever and elegant solution. A surgeon places a very thin, flexible tube right into one of the brain's ventricles. Then they tunnel that tube just under the skin all the way down the body and into the belly. This creates a brand new drainage pipe, letting all that excess fluid flow into the abdominal cavity where the body can just harmlessly absorb it. So this shunt sounds like a miracle fix, right? And don't get me wrong, it is absolutely 100% life-saving. But it's not a set-it-and-forget-it kind of fix. Living with a shunt means being aware, for the rest of your life, of what can potentially go wrong.
And this is a really important point to understand. A shunt treats the symptoms of hydrocephalus, but it doesn't cure the underlying reason it happened in the first place. This little device is a piece of hardware, and hardware can break, get clogged, or get infected. So constant vigilance is just part of the deal.
So it is vital to know the warning signs of a problem. If a shunt gets blocked, for example, the CSF starts backing up all over again. And what you'll see is a return of those original symptoms, the headaches, the vomiting, the irritability, or in a baby, that bulging soft spot again. Spotting these signs early is everything.
Now, an infection is a whole other serious risk. And the signs here are a little different. You're looking for things like a fever or maybe some redness and pain right along the path where the shunt runs under the skin. You might also see things like neck stiffness or even belly pain. Any of these are a signal to get medical help right away.
You know, the shunt is a truly remarkable piece of medical technology that has saved countless lives. But as we've just seen, it's not a perfect solution. It comes with its own set of risks, and it requires a lifetime of watchfulness. And that leaves us with one last, really important question. What comes next? What's the next frontier for researchers that can maybe, one day, lead to an actual cure, instead of just a lifelong management plan?